The type of pain I was in prior to surgery was constant pain in my left knee, which, it was daily. It never stopped. It never went away. It was there all the time. And it got to the point where I couldn't deal with it anymore. Couldn't walk through the grocery store without leaning on the cart. I couldn't ride a bike. I couldn't go up a flight of stairs, step over step. I finally did that for the first time in 5 years, 2 weeks ago. But even like going to a flea market or a fair or going to an antique market, daily things. I was venting to one of my other doctors, and he recommended Dr. Kuesis to me and said he would have him call me. I said, yeah, okay, just give me his number. You're not gonna have him call me, I'll call him. And oddly enough, I was in my car driving home from my appointment and my phone rang. And it was the office. They were calling me to set an appointment to come in and come see him for an evaluation of my knee. And seeing that I trusted the doctor who referred him, the bond was immediate, and I decided to move forward with a knee replacement. Dr. Kuesis was there the entire time helping me. Comes in, visits prior to surgery, prior to going in, and then after surgery, coming out of OR, the surgeon's assistant came in to see me because Dr. Kuesis was tied up in surgery. And oddly enough, because our schedules collided with my therapy there at the hospital, 2 days later, 10 o'clock at night, I opened my eyes and there he stands. And I'm like, I said a few choice words, what are you doing here? It's late at night, don't you have a home? And he's like, well, I needed to come and see you because I didn't have an opportunity to see you after surgery. And I thought that in itself shows that he cares. Shows that he cares, that he wanted to see how I was doing, how I was progressing. I had a little hiccup and he checked up on it and said everything was cool, and I was ready to go home the next day. So it was very special that he made that opportunity, that visit late at night. It was nice. It was very nice. He didn't need to do it and he did it. Staff was very informative, took time and patience with me because they deal with this every day. I didn't. Even though I was online, internet, looking things out, but there's still so much you don't know. And they're there to answer my questions. They were there to, I constantly would call and they'd get back to me and they answered my questions. They calmed me down, they calmed my nerves down. The aftercare, same thing. And then going into therapy, even better. And now with the therapy part of it, Chris, he's not just my physical therapist. Like I said to him, he needs to be a psychologist because of dealing with the emotional highs and lows of therapy after such, a big surgery. I not only would recommend Orthopedics and sports medicine, but I already have. My family, anybody who asks, anybody who comes up to me and talks about it, definitely I would recommend them to come here and to have their surgery here and to have their therapy here, without a doubt.